Knee and shoulder injuries are very common in sports.
Why are athletes so prone to these injuries?
Our guest on this week's Health Talk, an expert in sports medicine, will explain. He will also offer some tips on how to prevent sports injuries, so stay tuned.
Eric and I are up next.
Hello, I'm Dr. Eric Mazer.
And I'm Dr. Vicki Smitak. Today we're going to talk about sports medicine with Dr. Joshua Frank, who's an orthopedic surgeon and also on the medical staff of Norwalk Hospital. Welcome to our show.
Josh, great to have you. A very timely topic. You're an expert in this stuff.
Thank you very much. I appreciate you having me on the show.
So we're talking about sports medicine. I guess, kids, adults, we're all into sports and staying fit these days.
Yes, we're a very fit community.
That's right. There's a TV show coming on that's going to, I think, talk about that.
That's right.
So anyway, but we all get injured doing this. So what are the common things that you see?
Sure. While it's a common question, a little difficult to answer. I mean, we can look at sports injuries in terms of trauma, an acute injury, somebody's out on the field, twists an ankle, hurts their knee. There can be more what we call subacute, which are not quite as dramatic, but over the course of days to weeks. And there can be more chronic injuries, kind of long-standing, usually a little more mild, but still affects your ability to participate in sports.
So maybe to start off with, weekend athletes and what can we do? What should we be doing to prevent injury in general? What's good physical hygiene for the athletes?
Sure. So a lot of times I think what gets people into trouble is a sudden change in their activity level, and that can be kids with how they grow. It can be the beginning of seasons, particularly fall and spring, where they haven't done as much activity, and it can be in adults in such as weekend warriors where they don't do anything on a consistent basis and then go out a little bit hard on the weekend. So a lot of times preparation is really the best avenue to prevent injury.
So being a weekend warrior, I guess, would be ill-advised. But folks really struggle with the work week, right? Most of us struggle with the work week. It's hard to get to the gym a lot of times. It's hard to go out and play a sport on a Wednesday morning, or for most of us. I know that there are people who make it a priority, but then the rest of us who kind of try to get through the work week and do everything we're supposed to do.
The rest of us human procrastinators.
The rest of us normal human beings, right? Try to make up for it on the weekend. So, and of course, you don't want to let the weekend slide too, because then the more you do that, the more you sort of lose your fitness momentum and whatnot. So is there, other than really being diligent on a consistent basis, what can those weekend warriors do to make it so that they don't get injured and then fall into disrepair?
Right. So obviously, myself included, would love to make it to the gym and exercise more during the week, but all of our schedules prevent that. So even some small things such as a consistent base stretching, we're talking even 10, 15 minutes in the morning or at night, even a moderate or mild level of physical activity, even some things you can do in your own home just to stay active, stay flexible, so that when the weekend comes, you haven't actually sat around all week. Sure, you worked hard and you maybe didn't go to the gym for an hour and a half, or you didn't run 4 miles, but you still maintain some activity levels, so your muscles are working, whether it's a little more active during the day in terms of activity and walking, but maintaining your flexibility is, I think, a very important part. And then the other avenue is on the weekends, even if that's your normal routine and you like to be active on the weekends, even some mild changes can actually be a big shock to your body. So going from running 2 miles to 4 miles is a huge change. So what we like to do is have people really build up and make slow, gradual, incremental changes so their body gets used to it.
Can you talk a little bit about stretching and warming up? I remember you used to go touch your toes and this, and then I've heard people say that, well, those acute movements are not good. You should be doing it continuously. What's right in terms of stretching and warm up? And then I've even heard that doesn't prevent injury, stretching. So I'm confused.
As most people are, and even doctors can be, and the research can be a little confusing as well. We do think stretching in general is beneficial to maintain the elasticity of your muscles and tendons and ligaments. Sudden violent maneuvers like you're describing, we definitely have gotten away from a little bit. More fancy terms called static progressive, where you make small incremental gains and you're not bouncing quite as much. And then there is also dynamic flexibility stuff, which is a little more complicated things where you're working on your flexibility as you're moving along. So I think the key with flexibility is it's very easy to fall in the trap and say, well, I'm just not a flexible person. I've never been able to touch my toes, so that's just not for me, and move on. When it actually, people really can make improvements, but it's not magic improvements in a day or two. It's a nice program, and over the course of weeks to months, you may actually notice that, wow, I am really much more flexible than I used to be, and you'll feel a little better and help try and prevent injury.
And but increasing that flexibility, then, is it fair to say that that is a key to preventing a lot of these sports injuries?
Sure, we think it is, and we definitely suggest it. I mean, some injuries are not preventable.
Right.
People always ask, even in a bad injury, they tore their ACL, they get it fixed, they go back to football, can I hurt it again? Well, of course, you're going back to sports. There's an inherent risk no matter what we do.
Right.
And that risk does increase in age. Certain injuries are much more common as we get older. Achilles ruptures, things like that, definitely tendon ruptures. We don't see those as much in young people as in older people because the body does undergo changes with age that we just can't prevent. So it's not that stretching.
It's
not stretching's going to guarantee it, but you definitely want to hedge your bet and kind of push yourself to be as preventative as possible.
Just a little bit more on the actual technique for stretching. So should people be reaching for their toes for 5 or 6 seconds and then relax and then keep doing? What is a non-dynamic proper way to stretch that?
In the interest of talking to a general population, it's a little hard to answer that because everybody can have so many variable factors. Somebody who has a back issue, the flexibility may be totally different as to prevent them from aggravating versus somebody else in terms of how much bending versus extending. So it's a great question. I think really the idea would be to, if you have a lot of conditions or medical conditions or some pre-existing stuff, probably touch base with your physical therapist or your physician, maybe try and have somebody outline a program taking that into account because everybody is a little different.
How about personal trainers? I know that they're out there, a lot of people use them. Do they, I have no idea what kind of background they have or if they have the information to tell you, and if it does vary, I guess it does, how do you pick somebody who's good?
I wish I had an answer to that one. There's a lot, as Vicki said, there's fantastic personal trainers and there's some that don't have nearly as much experience. So their goal, which is what we want their goal to be in terms of to improve your conditioning and to push you, but they just, for each particular trainer, you just want to find somebody that sort of fits where you're at in life, right? So the 18-year-old person training to go to D1 college is definitely going to have a much more aggressive trainer, and that's what they should have.
Right.
And somebody who's maybe 65 and hasn't exercised much and wants to get into a program just wants somebody with the experience and expertise to learn how to put them in a nice program and not aggravate
and
condition.
not get injured. Right.
Exactly, and there are modifications in how we exercise, even something as simple as the position of hands, what to do, what not to do, where your knees are in relation to your toes that you can do an exercise that you think is helping you but actually be hurting you.
Yeah.
So technique, I think, is kind of what you're getting at. The technique of the exercise has to be based on the person, but proper technique, proper training, and a slow gradual increase is really what the key factors to prevent injury.
Right.
So are you recommending that all of us, particularly those of us who are older and have orthopedic issues, that we get expert help in sort of designing a training regimen? Sounds too exotic. An exercise regimen, right? A workout program.
I think we get your point. That is, of course, the ideal. Now, unfortunately, finances and everything else and time and energy prevents that for a lot of people. But that is definitely the idea, to see, at least to do a little research. And if you're going to do it on your own, just keep in mind, let's say it's been 5 years since you were really active, just keep that in mind. And you may still be young and healthy, but just keep that in mind that every time you have a period of time off, you just want to build up and start. I like to tell people to start adding things a little bit at a time. So you know what one exercise really caused a problem, you can take that away. And if you have the ability to get some advice, at least do some research and whatever you can possibly do, just to try and go at it in a smart fashion.
Let me ask you the inverse question.
Sure.
Is how quickly do you decondition? I heard that you decondition pretty quickly. If you're doing exercise and you stop, I've heard as little as 2 weeks you've lost
Well, it's actually, people get injured in the hospital with major injuries. Muscle starts undergoing atrophy, which is a process of turning into fat within, it can start upwards of 2 days. Wow. So deconditioning can happen pretty quickly, which is why, as we spoke about earlier, just a little bit of exercise, at least something to keep your elasticity, keep the muscles going, even if it's as little as 15 to 20 minutes, even if it's just some stretching. Anything you can possibly do on a consistent basis to exactly prevent the disuse.
Because that's discouraging. I mean, if you've made some gains and then
very discouraging. I had made tremendous gains, and I've got.
And you
I'm
take
going
time
back
off.
to square
I
one.
think we're all in the same
And
boat.
you'll find that when you go back to square one, a lot of times you are able to ramp up faster. But what you have to keep in mind is if you get hurt, the time off as we get older does take longer, and the time off really prevents you from where those small incremental gains, or if you go from 0 to 100 miles an hour and now you can't exercise for 2 months because something hurts,
right.
Did you really help yourself, right?
Right, and that's a good point. Yeah. The other topic I want to touch on with you, Josh, and maybe we'll even take it into the next segment, sure, is injuries or overuse syndromes in the younger athletes. And younger could mean even like 9 and 10-year-old kids. I mean, we all live in this community. We see what kind of sports activity kids are exposed to pretty aggressively, I think, on some level. I mean, again, my frame of reference obviously is very different because I didn't grow up here, but still, you see 9-year-olds, 10-year-olds pitching, entire Little League games and whatnot, and you kind of wonder about, these kids being sort of earmarked for a particular sport at such an early age. And I know that this has gotten a lot of media attention lately and things like that. Do you see a lot of children showing up with these types of injuries?
All day, every day. Yeah. So the points are great. So, back years ago when people did 3 sports, took the summer off, or went into a kind of a general summer camp type thing, or various activities, we didn't see it quite as much. Mm-hmm. So what's happened over the past many years is there's been a focus on one sport at an earlier age,
right, and
there's been focus on year-round activities,
yeah,
and not giving your body time to rest. And those factors have led to an increase in overuse injuries, especially among kids and young athletes. So when we're using the same muscles over and over again and kind of not using other muscles, that can predispose people. And we're also not giving the body a chance to regenerate and grow and heal, kind of chronic injuries. So yeah, we do see that even some season-dependent stuff, especially in the fall and the spring, if kids aren't, or people, I should say, athletes aren't quite as active in the summer and the winter respectively, yeah, they're, let's say, enjoying themselves. August, they do some vacation, they're just kind of hanging out, and then spring comes around, yeah, fall comes around,
and then they launch into it.
And their coaches are doing what they're supposed to do. They're trying to get them into shape as fast as possible. Right. These sudden drastic increases in activity can lead to these kind of injuries. So yeah, we really like to encourage people, think ahead, think of this season coming up, start getting into shape well before the coaches are
some
so the coach really shouldn't be getting you into shape. You should be getting into shape, right, and then hitting your formal.
So we use the example, professional athletes are in great shape before they come to camp, right? So at least a little activity, getting your body used to it prior to sudden increases.
We should keep this train of thought. Actually, we have to take a short break, but after we come back, I'd love to pick this back up because I think it's very relevant. I think, and a lot of parents who may be watching the show could probably get some good information. And grandparents.
I'll talk about that in the next segment.
So thank you, Josh. We'll be back after a short break.
Stay tuned.
We are back with Dr. Josh Frank, and we were just starting to touch on overuse injuries and other types of sports injuries in children. So maybe we can just pick up that thread a little bit. Sure. Josh, we talked about, maybe we can talk about specific sports, or we can talk more globally. I know there's a lot of research out there now, and we know a lot more than we used to know about how kids get injured. And first of all, what makes them more susceptible? Maybe we can even start there.
Sure. So a variety of things. Number one, the growth plates. So kids' growth plates are actually more susceptible to injury. They're somewhat weaker. So an injury that would cause damage to our ligaments and tendons can often be a growth plate injury, because kids' ligaments and tendons can be somewhat stronger.
Yeah.
And that can be an acute injury such as a fracture, or it can even be an overuse injury, particularly baseball players. We see that a lot in the shoulder. We can actually see on x-ray a widening of the growth plate, and we can x-ray the opposite side and show that there's a difference, and that's a sign of injury.
Pitch or all players?
Well, baseball in general, but definitely the more you throw. So there's a lot out there in baseball. That's probably one of the more common ones that we see. There's been a lot of research in terms of pitch counts, how many innings or pitches you should throw at various age.
Right.
There has been some research as to what types of throws at what age. That's a little trickier because there's been some counter arguments to that. But that really stems from, even if you look at the pros and they have a 5-day pitch cycle, the body does need time to rest, and pitching is definitely a little bit of an unusual motion for people, and repetitive stress injuries and repetitive throwing without a break and recovery can lead to injury.
And also doing it year-round rather than doing seasonal sports. I know we talked a little bit about that during the break, but we should talk about it on camera. Also, you know, kids used to play baseball for a finite season, but now there's, you know, ball playing throughout the course of the year. And I understand the purpose is so that they keep developing their skill set, but the flip side of it is that they're causing damage, probably.
Right, and it goes to the same argument. If you kind of, quote, break down or fatigue, that can lead to a problem, and you're out of sports somewhat longer. So baseball is a great example. The rotator cuff muscles are very important. They help stabilize the shoulder. If they're not firing and they're weak, the shoulder can move around and become a little unstable. That can lead to inflammation, pain, or even further injury, such as tears of the labrum. So making sure, if somebody's going to do a year-round sport, there are exercises that they should be doing, working on making sure they strengthen. They shouldn't be doing the same amount of pitching all the time. There should be some variation in what their body experiences.
So given the fact that we only have a half hour for this show, and I think we could talk 2 hours on it, let's just say, what are the common injuries you see? Speaking to the folks at home, what are the things that, you know, the sprained ankles, the sprained wrists, the sore shoulders, and what should they do? When do they come see you? Give us some sense of and how do you treat it at home?
Right.
So, I mean, there's a couple key factors, right? If a particular joint is very swollen, if you can't bend it, you can't put weight on it, if there's an obvious deformity, something doesn't look right, you should really seek immediate medical attention. If it's something you can walk on, it's a mild sprain, or that you think it's a mild sprain, it's actually not that fact is absolutely true. Just because you can walk on something doesn't mean it's not broken. And especially minor injuries, even fractures to the growth plate, sure, you might be able to walk on it, but they really do need to be protected so that you can prevent further injury and allow normal healing and development. So the general factors at home people talk about, rest, ice, compression, elevation, are always good. Those are going to help primarily. You want to monitor and see if it's something that gets better and the kid's totally normal in a day or so. You know, just keep an eye on it. And even in those cases, you may not want to rush back 100% to the next day's practice. May want to just take it easy, 25%, keep an eye on it. But I think one of the main points that we're getting at here is that children and young adolescent athletes can have real injuries to their joints. So,
and things that are other than overt fractures.
Correct.
Especially these growth plate injuries. That
So there can be mild, or it can be sort of subacute or even growth plate fractures, which is an acute injury, but they can have legitimate injuries the same as adults. I mean, we do see meniscus tears, ACL tears, cartilage problems in kids. So those old days of it's just a sprain or it's growing pains, we really don't like to use that term. We like to be a little more specific these days.
I've heard through my career, well, I can move it so it's not broken, or I can stand on it so that means it's not broken. Therefore, I don't need to see the doctor. That's really not a very good differentiator, is it?
I wouldn't fall into that trap. Things can be missed, and while sure, you know, we may end up seeing some more bumps and bruises and minor sprains, I'd much rather see 100 of those than miss a major injury, especially in a young developing person, but in anybody for that matter.
So the message to folks at home is, if in doubt at all, just go have it checked out.
It's always better to have it checked out, and sometimes we may even say, well, let's keep an eye on this and protect it in some avenue, whether it's a brace or some rest or whatever the case may be. But it's always better to treat an injury correctly from the beginning. It usually allows a quicker return to function and less actual time out of sports, and tries to prevent it from becoming a more chronic nagging injury that will actually keep you away from your peak performance for much longer.
And I think it's probably a fair statement to make that if there is an injury like that, a sports-related injury, the best specialist to see would be a sports medicine doctor or an orthopedic specialist or something like that, and rather than going to a random walk-in clinic, which, I know folks on the weekends, especially these injuries can happen usually on a weekend, and
Sure.
then it's like what to do. Maybe you can talk a little bit about that.
Sure, and it puts people in a tough position sometimes because they may only have access on certain days. So seeing a specialist in a particular area, we would all agree is probably best for most things.
Yeah.
Various specialties, not just orthopedics. Not always, and it depends. But in this particular thing, if there's a knee injury, sure, you want to see primarily somebody who deals with that on a somewhat regular basis. So
Right.
the differences between kind of an emergency room and an urgent care and an orthopedic urgent care, there are some variations. The emergency room is fantastic. They do a very good job of all emergencies and definitely is an absolute necessity for a lot of things, particularly major injuries, weekends, nights, etc. Absolutely. Urgent care is kind of similar. There can be great urgent cares and some that may have specialists in certain areas, some that may not,
Right.
that may not be able to provide definitive care. If that's the only option, of course, it's always better. There's
Right.
still a medical professional. They can refer you to the necessary. Do you have to go to an emergency room or not? And then, what we've done at Coast Orthopedics as well for that reason is to try and create an orthopedic urgent care and allow more walk-ins, because that's what people really need is
Right.
some way to get in and get checked out for these injuries.
And that's a great thing that you guys do. And
I think
know
we're
that's a
lucky in this
trend.
area to
Right.
have that available.
Yeah.
When are you guys available? When is the walk-in open?
Pretty much 8 till 7 most days, Monday to Thursday, 8 till 5 Friday, and Saturdays 10 to 4. So, I think that people...
That's here in Norwalk. I just want
Yep,
folks at
yes,
home
yeah,
to be
that's
able
here
to
in
do that.
Norwalk. That's here in
So
Norwalk.
they can just walk in if they've
Correct.
sprained their ankle or...
Yeah,
or
correct. Yep. So we try and provide the service that people need.
You
And
guys have x-rays available so
Sure,
you could
yeah, of course,
make
yeah.
diagnosis and treat fractures, right? Right there.
Exactly.
So that's a tremendous service. I mean, that in and of itself, because again, you're going right to the source, you're going right to the expertise, and you're right. I mean, it could just be a bump or a bruise, but you'd rather still err on the side of being a little more cautious than.
Well, we try to provide what people want and need, and if it were my child or family member, of course, you'd want to get checked out as reasonably quick as possible. So. Again, just, it's most important that people sort of recognize injuries and try and seek attention when necessary. And as your point was made, we'd much rather see something minor and make sure it's nothing major than miss something that is of importance.
What could be something like, so we talked about growth, you mentioned the growth plate a lot,
Sure.
and I know as a pediatrician the importance of that as
course,
well, but
yeah.
maybe we can talk to our audience a little bit more about why that's important and what could happen if you miss an injury that in a developing child or adolescent.
Sure. So there's a area of bone that's still cartilage, and that allows bones to grow both in length and in width.
Right.
If there's an injury to that where those cartilage cells are injured and that part stops growing, bones can grow abnormally. They can either not grow in length or width, or they can grow in a somewhat crooked fashion.
Right.
And that's a hard problem to fix. So while it's not as common as just a minor injury that requires immobilization for a couple of weeks and gets better, those kind of missed injuries can lead to deformities as we get older and impair function.
Yeah, and that's why it's important.
Yeah.
Yeah.
I mean, I think it's good for all of us to remember, why, even when you mentioned with baseball, with pitching, you see a widening of the
Right.
of the growth plate, and that could lead to deformity of the shoulder later on.
It could lead to problems, yeah.
Now let me take to the other end of the
Go ahead.
spectrum. Those of us who are baby boomers, I think baby boomers are different than a generation before. We're active much later in life. We're active doing sports and athletics. And so what are the injuries then that you begin to see on the other side of the spectrum that people have to look out for, and how do we prevent it? Because
Sure.
things do hurt more now than they did when I was 20.
Absolutely. So I think we've touched on some of the preventative stuff with consistency and gradual increases in flexibility. But, for a perfect example, what you're getting at is rotator cuff tears, right? So you have some pain in your shoulder. Does it need to be checked out or not? How much can you ignore it? What can you just power through it? And that's a perfect example, because a minor rotator cuff tear, a little partial tear or some tendinitis, sure, it's painful. We do some medicine, some therapy, even some injections, that kind of stuff. But a full tear, which a lot of people will just sort of tough out and try and make it through, that's actually a problem, because over time that tear gets bigger and bigger, and the success rates of fixing it do go downhill. So particularly when there's weakness in the shoulder, when something hasn't gotten better, you know, in this example, if it's been bothering you exercising for a couple of weeks, you've taken some Motrin, et cetera, it's starting to bother you at night while you're sleeping, you really want to get that checked out. I've had countless patients, particularly tough guys, do a physical job, their shoulder's been bothering them for years, and they have an injury that finally brings them in, and I see this tear that is just a big, massive rotator cuff tear, and the difficulty fixing that and the outcomes are not as good as had they come in much earlier.
It's a pretty consistent message.
So don't
Catch it
ignore
early,
injuries.
just like with the kids. Don't ignore
Don't
injury,
ignore them.
especially if it's persisting for more than a few days. If it hurts, have it checked out, and that's all we have. Boy, I said we could keep you here for
a lot
hours.
longer.
I want to thank Josh. We're going to keep him here because we have some questions when he comes back, and we'll have this week's health question.
But right now, let's take a look at some of our future events sponsored by Western Connecticut Health Network. This week's viewer question is, what is the difference between an acute and a chronic sports injury?
And remarkably, we have an expert. We've discussed this a little bit before, but maybe you could review the difference between acute and chronic injury and your approach to it.
Well, I think the easiest way is an acute injury, something that's relatively easily recognizable. Somebody twists their ankle playing soccer, an injury to the knee, acute onset of pain that causes them to have less function. A chronic injury can be quite significant, but it's usually the time frame is what we use. Once it's been somewhere between days to weeks, there's sort of a period in between that we call subacute, which is in the few days to a few weeks, and after a few weeks, we usually call that a chronic injury.
Yeah, and chronic injuries, I would imagine, are the ones that are left neglected, probably more often than not, because you're hoping it'll get better.
Exactly. Often, or they start out somewhat small and you ignore them, and then they get worse and worse, and you end up sort of modifying your life to meet the problem rather than addressing the problem.
And again, you know, I know especially we older men are worse at it. See the doctor. You see the doctor.
Definitely see the doctor.
And have it checked out. So unfortunately, that's all we have time for, Josh, Vicki. If you have a question from home you'd like to ask on Health Talk, please contact Vicki and me at healthtalk@norwalkhealth.org.
We would like to thank our guest, Dr. Josh Frank, for coming on our show today, and we will see you next week on Health Talk.
Bye-bye.